Good morning. My name is Idelva, and I'm a student physical therapist assistant. Today, I will be working with John, who's a 42-year-old male patient who has recently had an exacerbation due to multiple sclerosis. Uh, Multiple sclerosis is a chronic demyelinating disease of the central nervous system. It attacks the nerve fibers of the spinal cord and the brain. Uh, when this happens, it causes the inflammation and destruction of the axons. And and when the axons get destroyed, it basically causes scar tissue, and that scar tissue that's left on the brain and the spinal cord is what causes the multiple sclerosis and causes people to have exacerbations and all the symptoms that multiple sclerosis has. Common symptoms of multiple sclerosis is fatigue, spasticity. Uh, it'll leave you with balance problems, uh, cognitive issues. There are multiple problems people will face who have multiple sclerosis. So John has recently been, his doctor recently referred him to physical therapy due to the exacerbations he recently had. Now in John's case, he's having excessive fatigue, and he's also having some spasticity in both lower extremities. Um, the type of MS John has is relapse remitting. And basically, relapse remitting is every time you have an exacerbation, you're never going to quite fully recover, but you can get real close to it. And so we're here to basically try to get John to get back to the highest level of function that he can get and try to basically decrease the progression of the disease and exacerbations. John has a AFO device on both legs, which is basically an ankle foot orthotic because he has drop foot, and those devices is helping him when he has to walk so he can pick his foot off the ground. And that's one of the things we're going to be working on therapy with today is the drop foot and the fatigue. Now, John has two short-term goals. This first one is to be able to walk the 10 flights of stairs that he has in his home just by using the railing as assistance. And his second goal is to be able to walk 250 feet so he can visit his best friend who stays in his neighborhood because he usually likes to walk to his house. And so today we're going to go through some exercises and work through some endurance training so we can get John started on his path to recovery. And we're ready to let's get started. Good afternoon, John. How are you?
Good, how are you?
I'm doing good.
Good.
My name is Idelva. I'm a student physical therapist assistant. And today I will be working with you.
Okay.
Uh, so, is it okay if I call you John?
Yes, that's fine.
All right. So, I see you've been having some fatigue and muscle weakness
Yes.
due to a recent exacerbation of your due to the MS.
You're right.
Oh, okay. So, how are you feeling right now? Are you in any pain at all, or
No, I'm okay today.
you're
Just
okay?
a little bit tired, so.
Oh, okay. So today, what we're gonna do, we're gonna work on some exercises to help with the weakness, so we can strengthen some of the muscles,
Okay.
and we're also gonna do some endurance exercises, so we can basically build up your endurance.
Okay.
Because I know you're having a lot of problem with fatigue.
Right.
Now, the reason why you're having the trouble with the fatigue is basically the it's thought to be due to the nerve messages from the brain and the spinal cord having to cope with basically the areas of damage that's been caused by the MS.
Okay.
So that causes you to get fatigued a lot quicker than usual.
Okay.
All right. So as we do these exercises, it might require me to kind of put my hands on you so I can help navigate you through, so I can make sure you're doing correctly. Okay? Is that okay with you? All right. So let's get started.
Okay.
The first thing we're gonna do, we're gonna test the strength of a muscle called the anterior tib,
Okay.
and that's the muscle that basically, when you walk, it helps you lift your foot off the ground.
Okay.
So I know you've been having trouble getting that foot off the ground, so we're gonna test to see how strong that muscle is. All right.
Okay.
So you mind taking your shoes off for me?
Yeah. Take both of them off. I'm gonna get comfortable.
All right. So
Let's see. You know, just like
all right.
Sorry with my toes.
It's fine. So what I want you to do is try to take your foot and try to raise it up in the air and see if you can do that for me. All right, so you're unable to do that. Let's see. Are you able to do it right now? Try it again. All right. So you're at about a 2. If you were able to do the whole motion, you would have been at a 3. But I can see that that muscle is weak right now. All right, so the second thing we're gonna do is I want you to lay down. All right, so the second thing we're gonna do, I'm gonna test the range of motion you have in your hip flexors. Basically, that's basically when you're walking, those hip flexors are the muscles that you use to kind of lift your legs up, okay? So we're gonna see how much range of motion you have. All right. Yeah. So what I want you to do is bend your knees for me. And I want you to try to bring your knee up towards your chest, all right? As much as you can. All right, we're at about 95 degrees. That's pretty good. All right. All right. So the second thing we're gonna do, go ahead and try and sit up for me. So I know one of your goals is to be able to walk 250 feet.
Yes.
So before we get started on our exercises, I want to see how far you can walk for 6 minutes, okay? So we're going to do a test called the 6-minute walk test.
Okay.
And basically what we're going to do is we're going to start, and I'm going to time you for 6 minutes, and we're just going to see how far you can walk for 6 minutes. Now, if you need to take a break, you can take a break at any point. If you need assistance, I can assist you, but I will document that I assisted you, okay?
Okay.
So you can do it at your own pace. But before we start, I'm gonna put this gate belt on you, okay?
What is this called again?
Oh, this is called a gate belt. Basically, this is for your safety.
Okay.
It's for me to help you, just in case you need any help. And it prevents falls.
Safety first.
All right, that's not too tight, is it?
No, it's not.
All right. Stay right here. Get your wall fitted. All right, on 3, we're gonna get up, all right?
Okay.
So I want you to bring your feet back. Lean forward.
Okay.
All right, and when you're getting up, I want you to push.
Okay.
Yeah, push with your hands on the walker.
Okay.
All right, on 3. 1, 2, and 3. All right, now we're gonna walk towards right here.
Okay.
So we can start. Now I know you've been having a lot of problems with fatigue, so I'm gonna let you sit for a minute.
Okay.
And then we'll begin the test, all right?
Okay.
All right, so how do you feel so far?
Feel okay so far. I wasn't too
Okay.
bad.
All right. So after about a minute, we'll, so you feel like you're ready for the test?
Yes.
All right. So what we're gonna do, now I have my aide back here.
Okay.
Now I'm gonna be walking with you. At any point, she's gonna be following with the wheelchair. So at any point when you get tired, you just let me know and we can have a seat, okay?
Okay.
All right. Matter of fact, here, let me grab my time.
Okay.
And I'm gonna time it for 6 minutes. All right, ready?
Ready.
All right, lean forward for me. All right, on 3. Remember to push up again.
Okay.
1, 2, and 3. All right, and start. How are you feeling walking?
Okay.
Feeling okay?
I think heavy. Getting tired, Sean.
Getting a little tired?
Yeah.
All right, if you need to sit, I have the chair right behind you, okay? All right.
Sit.
1 second. All right, go ahead. All right.
Yeah.
And I notice when you walk, you kind of bring that leg out a little bit.
Mhm.
That's probably due to the fact that you can't lift it
Right.
because you can't clear it. So we're gonna try and work on that also, all right?
Okay.
So I'm gonna let you rest for a couple of minutes and then we can get started again.
Okay.
All right, after a few minutes of rest, you feel like you're ready to get started again?
Yeah,
So
we
we
can start again.
All right. All right, go ahead and stand. All right. All right, you did good.
Thank you.
Go ahead. Let's get right here. All right, you go ahead and have a seat.
Okay.
All right. So you were able to walk a good 200 feet in a 6-minute span. I know your goal is to walk 250 feet so you can be able to visit your friend that lives close to you.
Yes.
But you're close to that, so we're just gonna keep walking on some more endurance, working on that, and we'll improve. All right. The first exercise we're gonna do, we're gonna work on that strength of your anterior tibialis, which is
Okay.
the muscle that helps with the foot, basically helps lift your foot up when you walk.
Okay.
All right, so we're gonna kind of do an isometric exercise, and we're gonna use this band, okay? So I want you to kind of bring your legs right here. All right, so I'm gonna show you real quick. Basically, what you're gonna do as you're sitting,
Mhm.
you're gonna have the band like this. Let's make sure you can see. You're gonna have the band like this, and you're gonna bring your foot up,
Mhm.
and you're gonna hold it for about 5 seconds, and then you can release it slowly.
Okay.
All right, and bring it up. All right, and you could just do about 5 of those because I know you get tired real easily,
Right.
so we don't want to overwork you. All right, so we're gonna. You should feel a stretch back here.
Yes.
And as you try to press down on it, you should feel
Come there.
this contract.
Yeah.
All right.
Feels good though.
Feels good? No pain, right?
Okay.
All right, one more. All right, and we will do about 2 sets of 5 on each leg. All right. All right, now the second thing we're gonna do is I'm gonna have you get up real quick. Stay right here.
Okay.
See, and can I have my aide? You think you can grab the walker for me real quick? Thank you. All right, I want you to scoot forward until your feet is touching the ground. All right, now go ahead and stand for me. All right. Now we're gonna, you can stay just like here, just like that. All right, now bring this walker forward. Now the exercise we're gonna do is basically, you're gonna be standing
Mhm.
and you're gonna just bring one leg up
Okay.
and you're gonna do that 8 times
Mhm.
and then do the other leg 8 times, okay?
Okay.
And this is basically helping work on your hip flexors. You should feel this
Okay.
muscles right here. You should feel those contracting, okay?
Okay.
When you're doing that.
Okay.
Right. Let's bring it in a little. All right. And this is also working on your balance also.
Oh, I'm popping.
Popping? Any pain doing that?
No pain. Just feel like it was. So I'm working. I feel everything contracting, as you said, right here in the front.
Yeah, you should feel it.
Exactly.
It's working right on the front of that thigh.
Yeah, it's good.
All right, and we'll do 2 sets of those, about 2 sets of 8, because I know you get tired real easily. So go ahead and have a seat again.
Okay.
And I'm gonna let you take like a 2 to 3 minute break, because I know you're having a lot. The exercises we're gonna be doing, they're called toe taps. So basically, you're gonna have you come up right here. And you're gonna, it's basically simulating going down the stairs, okay? Well, I want you to just, as soon as you tap your feet, raise it back up, okay?
Okay.
And what that's doing is working on the strength of the quads and the hamstrings.
Okay.
And just go back up. And I want you to do it slow and controlled, okay?
Okay.
All right.
You ready? Yep.
All right.
This way.
It's okay, I got you.
Okay.
I have you.
Coming up. Straight down.
All right, yeah. Go ahead and bring this leg. So down, tap, come back up. Do it slow. And as you slowly go down, you should feel the burning right there.
Yep.
On top of that, where that quad muscle is.
Right.
All right, and we will do the other leg also. Okay. All right, we're doing great. Slowly and control. All right, so we will do about 2 sets of 8 of those.
Okay.
And we'll work for on going to 2 sets of 10, but I know right now you get tired easily, so 2 sets of 8 is okay. All right, so the next exercise we're gonna do, we're gonna basically walk up these stairs, right? So I know you have about 10 flights of stairs in your home.
Yes.
And I know one of your goals is to be able to walk up the stairs without getting tired and basically
Right.
using the handrail as assistance.
Right.
So when you're walking up the stairs, I just want you to do it, take your time, you know what I'm saying? It's okay to use the rail that's right there. So do it slowly and make sure you don't do it too fast, because I don't want you to fall or anything, okay?
Okay.
All right. All right. Move this out of the way. So go ahead, all right. Take that first one. Nope. Remember,
Oh, this one?
Yep,
Okay.
that one right there.
Okay.
We don't want to try to take 2 at a time.
And I'm trying to speed up these stairs.
No, we don't want to do that.
Okay.
Good job. All right, try to use those hip flexion muscles. All right, try not to bring your leg out too much.
Okay.
How's that feel?
Feel pretty good.
Getting tired?
Not so much.
No?
Not so much.
All right, now let's practice going down. All right.
Okay.
All right, now when going down, I really want you to do it like have control when you're going down, because I don't want you to end up falling or trying to go too fast. All right.
Okay.
All right. Oh, not too fast.
Okay. You gotta keep telling me. I feel good with one thing. I try to keep going.
All right, John. So here I have some exercises for you to do at home. Okay. Now, when it comes to the home exercises, they're very important because I can't see you every day. You know,
Right.
you're not in the clinic every day. So when you are at home and you're not doing anything, say you're laying down, you can easily do these exercises, and it's gonna help the progression. All right. So I know you want to get out there, and I know you want to be able to go back home fast and go up the stairs and walk. So it's important to do the home exercise program, exercise that I'm going to give you. All right. So here they are, and they have all the how many times you need to do them, how many reps and sets. So usually I want you to do each exercise at least once a day.
Okay.
Okay. So that way you don't overwork yourself. All right.
Right.
So the first exercise that's on there is the seated marches. So I know today we did the standing marches,
Right.
but I want you to do the seated marches because they're a lot safer and it's easier to do. So let me show you first. So basically, you're gonna be sitting and you're just gonna be raising leg up just like that.
Okay.
All right.
Okay.
And just do about 8 on each leg for me.
Is it okay to have this in front of me?
Yes, you can have that in front of you. Just have it out
Right.
so it don't get in the way. Okay.
Let's see. So yeah.
And what this is doing is basically just helping with your walking. So when you're walking, you'll be able to lift that leg up and clear the floor.
Okay.
All right. How does this feel?
It feels pretty good.
It's good?
Yeah, it feels safe. I don't feel wobbly or too tired for this.
All right. The second exercise that's on here is gonna be the basically supine hip abductors. And basically what you're gonna be laying down and actually let me
Oh, you guys
just stand up for me real quick, all right? So I can properly show you. You can go ahead and have a seat in that wheelchair. All right. So you're basically gonna be laying down. All right. And all you gotta do is just bring this leg out just like that.
Okay.
And you should feel most of the contraction right here. This muscle is called the glute med muscle, and it helps with basically bringing your leg out.
Okay.
All right. So I just want you to do that for me, each leg, and let's try and see if you can do that for me before we move on to the next one. All right.
So just straight out.
Yeah, just straight out. Keep the leg straight. Just like that. Yeah, slow and controlled. No, we want to keep that leg straight. Okay.
Keep it straight. Okay.
Yeah,
Okay.
keep it straight.
Oh, yeah.
All right. Do you feel
I do.
you feel the track
Feels
right
good.
here?
Yes.
All right, and I just want you to do about 2 sets of 8 of those once a day.
Okay.
All right. And the next exercise, actually, you could actually just sit up from it. You can stay just like you can be good. Yeah, just like that.
Okay.
All right. Now this exercise is basically called a gastroc stretch. Now I know your foot is usually in a down angle all day, so
Right.
that means your gastroc muscle, which is basically your thigh, your calf muscles, so that could cause it to be tight, and that could also affect you being able to lift your foot up off the ground. So what I want you to do is, and you can even do this while you're sitting also. You can do it laying down or sitting. And you grab anything, a pillowcase, a sheet, or a belt, and what you do is you just kind of stretch that out.
Nice.
Normally I would want you to hold it for 30 seconds, but just hold it as long as you can.
Okay.
And then you just do that 2 times. So go ahead and see if you can do that for me.
Oh yeah.
And you should be feeling that stretch motor.
Yeah.
And that's also gonna help with the range of motion, basically how much that foot will be able to move.
Okay.
All right? All right, that's good. And I want you to do it on both legs.
Okay. Both legs when I'm
Yeah.
home? Okay.
When you're at home, okay?
Gotcha.
All right. So how did that feel?
Feel pretty good.
Not too tired?
Not too tired at all.
All right. Well, it was a pleasure working with you today.
Thank you, sir.
Just make sure you do those home exercises because
Okay.
they're gonna help you, okay?
Okay.
And I'll see you next week, all right?
All right.
All
Let's
right.
see.